Hospitals in many parts of Texas are seeing an increase in COVID-19 patients. That has the people heading up the pandemic response taking inventory of the state's medical resources. After 7 months of fighting the virus, state leaders say they're confident they will be able to better respond. There's more testing available and a stockpile of supplies. The state has recently surged resources to Amarillo, Lubbock, and El Paso, including backup for exhausted medical workers.
None of us went into the practice of medicine to zip up body bags. We went into it to be able to help and to be able to heal. And so I do think that it takes a toll on folks when we have just a never-ending stream of patients that need to be taken care of.
The state's top doctors say it's still up to individual Texans to continue to wear face masks and social distance to slow the spread. Family members who've recently been allowed inside Texas nursing homes under new state guidelines say they're already doing everything they can to stop the coronavirus from following them inside. Investigator Avery Travis has a look.
She's a Texas lady and she's ready for a burger.
After Jan Blex moved her mom into a San Marcos nursing home, she started bringing her special snacks and meals.
And that came to an abrupt halt on March 13th.
200 days of window visits kept them apart while visitors were banned. But finally...
You ready to see a visitor?
A very emotional walk to the room. They escort you to the room, and like the moment literally brought me to my knees.
Oh, who is that, Miss Colleen? Has it been long enough?
It's been a long time.
Blex was the first family member allowed back inside this home, becoming one of only 2 essential family caregivers allowed for her mom.
What's been your favorite part of getting to see me again? Do you? Well, that you're all right.
That I'm all right.
The state requires all of these caregivers to have a negative COVID test and complete training provided by their specific facility. Blex is a registered nurse, but says these hand washing and PPE techniques should be easy for anyone to understand, but important amid stern warnings from health experts about a possible surge in cases in November.
This is not over for nursing homes and long-term care facilities.
Still, Jan hopes they'll be able to roll back even more restrictions soon so she can make a special delivery. For State of Texas, Avery Travis.
Right now, the state limits essential family caregiver visits to 2 hours at a time, and masks are required. Facilities are also allowed to implement stronger rules or other safety policies they see fit. Thank you again for joining us for State of Texas. I'm Josh Hinkle. We'll be back next week to bring you an in-depth look at Texas politics.